I think this is a yes or no question. Do you support it being legal to abort an unborn child up to the moment of birth?
Senator Kennedy, it is not a yes or no question. I support women like Ms. Zarowski. Women
No, ma'am.
across
No,
this
ma'am. I don't. I think it is a yes or no question.
No, well,
If
let me
if
answer.
there were a law that's, I'm just trying to understand your perspective, and I'm not accusing you of this.
Of course
but,
not.
But you know, people sort of talk around this issue. If there were a bill that said that a woman has an unfettered right to abort an unborn baby for any reason up to the moment of birth, would you vote yes or would you vote no?
Senator Kennedy, I refuse to be shackled by your question. What I have answered is that there are conditions that
You don't
occur
know
during
whether you would
pregnancy.
vote yes or no?
There are conditions during pregnancy that mean after 10 weeks,
No, I said
14 weeks,
I said
20
unfettered
weeks,
discretion.
24 weeks,
You
conditions such
would
as Ms.
support.
Zarowski.
You're here
and
advocating.
I would support her life.
I
I would
understand,
support her
too,
personhood.
But you're advocating a law.
I support her
You're
personhood.
advocating a law that says that an unborn baby can be aborted up to the moment of birth for any reason, are you not?
Let me clarify what the 14th Amendment says in the first sentence, that citizens of this United States are individuals that are born. That is what our Constitution says.
But
Do
why
you
won't you
support our
answer my
Constitution?
question, Professor? I'm not trying to argue. I just want to understand what your position is, and I think you're afraid to say that you do support that. If you do support it, I think you, just for the purpose of an intellectual discussion, you ought to just say so.
For purposes of an intellectual discussion, I'm happy to have that with you, but
Well,
that's
then,
not the tone of...
could you answer my question? Do you support, please? I mean, you teach. Okay, I'm sure you've had students ask this question. Do you support making it legal to abort an unborn baby for any reason, up to the moment before birth?
Senator, let's have that intellectual discussion that you want.
We could start if you'd answer my question. I can't go to my next question until you answer that question.
I want you to be able to go to your second
good.
and your third
Answer it for
questions.
me.
I do. But as I have explained, there are many different conditions.
No, I said
during
unfettered discretion, no conditions. I'm making it easy for you.
Well, I have already shared with you, Senator, that I
I get
support
it.
women's
I don't want to use all my time. You're not going to
And I
answer
support
it,
Ms.
and that is your
Zarowski's
right. But I
personhood.
would respect you more if you just say, "Here's
I'm
my
sorry
answer."
that you don't respect
I
me
do
very
respect
much.
you, but I said I'd respect you more if you just answer my question. Doctor, tell me how to say your last name. Ms. Dr. Rubenhorst. Do you support a law that would allow, for any reason, unfettered discretion, the abortion of an unborn child up until the moment of birth?
No.
You don't. Dr. Verma?
Senator Kennedy, so I'm the one doctor in this room that does provide abortion care, and I can tell you that does not reflect the reality of
No,
abortion
I
care.
understand. I'm just asking the question.
It simply doesn't
But do you
happen.
support it? There are bills before Congress that will allow that to happen. You don't support it, or are you going to not
again,
answer my question?
As the doctor in this room who does provide abortion care, that is not how abortion care in this country works. It's a hypothetical that does a disservice
But if a
to our
patient came to you
patient.
and said, I'm going to probably have a baby this week and I've changed my mind, and I would like you, doctor, to abort the child, would you do it?
That is not how abortion care in this country
But if
works.
a patient did, would you do it?
My job as a doctor is to look at each individual situation.
I mean,
but
I'm
have
sorry, I don't
never-
mean to be rude, but I can tell neither you nor the professor will answer my question. I think you both have an opinion, and I don't understand why you won't share it. We're going to solve this problem.
I've
Doctor-
provided care for a
doctor,
few
how
years,
about
and I've
you?
never
Could you-
seen that situation.
How about you, Doc? Would you?
Do not support unfettered abortion, and I would like to point out that if a woman did have a life-threatening condition in pregnancy past approximately 22 weeks, that baby can be delivered alive by induction or C-section, and we can try to save that baby. The intent of abortion is a dead baby, and that is not necessary in that situation.
I mean, I want you to all understand where I'm coming from. This is a tough issue. And it's a tough issue because there's some tough questions we've got to answer. And when you won't answer the questions, when you're invited by my Democratic friends, the majority, and you won't answer the most fundamental question, we've got a bill in front of us that will basically say a woman has the unfettered right to abort at any time for any reason up to the moment of birth. And that's a gut check issue. And I would expect you as experts to answer that truthfully, how you do it. Thank you for your indulgence, Mr. Chairman.
Senator Graham.
Thank you. Very interesting discussion, and I think we need to put it in context of where the world's at. Dr. Stop, is that right? Are you from Texas?
I am from Texas.
Amanda's situation was terrible. What happened in Texas?
You know, Amanda, I want to say I am so sorry at your loss of Willow, and I am so sorry that your doctors misunderstood Texas law. I've reviewed Texas law, of course, because I practice there and I want to understand, as well as all of the other laws in the states. Every single law allows an exclusion for a doctor to use their reasonable medical judgment to determine when to intervene in a medical emergency, which is usually defined as a threat to the life of the mother or permanent irreversible damage to an organ or an organ system. None of the states have the terminology that the threat must be immediate. Doctors know, and we obstetricians have always known, even prior to Dobbs, the Hyde Amendment has been in place since the late 70s, and the Hyde Amendment allowed an exclusion for life of the mother. So doctors have been practicing, and I have not changed my practice in any way since the Dobbs decision. The American College of Obstetrics and Gynecology, in regards to the horrible situation that Amanda found herself in, pre-viable, premature rupture of membranes, where the water bag breaks, but labor does not ensue, and the baby is a long way from being able to live outside of the mother. The American College acknowledges that the risk of infection is high, which can become sepsis, which can threaten the mother's life. The likelihood that the baby can make it to an age in which it can live outside of the uterus is very low. And they tell us, and obstetricians do follow ACOG's recommendations for the standard of care, they tell us at the time of diagnosis that we should offer immediate termination of pregnancy, which they define as induction or dilation and evacuation abortion, or expectant management. So in a woman who is not currently infected and sick, I have had patients who have wanted to stay pregnant in hopes that they could get the baby to a gestational age where it could live, but it has always been the standard of care and continues to be the standard of care to offer delivery at that time. Most of my patients have opted for induction rather than D&E because they wanted to have a baby to mourn, but either one could have been offered and should have been offered to Amanda.
Thank you. 15 weeks. Is it fair to say that baby has a heartbeat at 15 weeks? Does anybody on the panel disagree with that? As a matter of fact, the baby has a heartbeat about 2 months before 15 weeks. Is that right, Dr. Stoke?
23 days after conception, there's a muscular chamber innervated by electrical impulses pumping blood cells which are oxygenated throughout the baby's body.
Does anybody disagree with what I said about the European standard that 47 of 50 European nations limit elective abortion at 15 weeks or less? Does anybody disagree with that? Good. The bottom line is 55,000 babies are aborted after 15 weeks in the United States. Is that right, Dr. Verberhurst? And most are elective, so this would matter. So I'm for my bill. I'm not asking you to be, Dr. Stoop, but I'm for it. Let me tell you why I'm for it. I'd like America at some point in time to say, 15 weeks being pretty good to me, that a baby is well-developed, can feel pain. You can't operate on the baby medically without anesthesia because the baby can feel pain in efforts to save its life, to draw a line. There's nothing unreasonable about trying to draw a line at 15 weeks when 47 of 50 European nations do that, with exceptions for rape, incest, life of the mother. What's unreasonable is allow abortion on demand up to the moment of birth. That's exactly what your bill does.